Good evening, everyone, and thank you for joining us for Doc Talk Season 4, Episode 23. We hope everyone has a Merry Christmas. We're going to go ahead and let Dr. Tennant take it away. Thank you, Doc. It's all yours.
Yeah, thank you very much, Jamie. We have a very exciting program tonight. We've got a couple of guests. Dr. Ibsen's got some very good news to talk about. But what I want to cover here to start with is first off, 2 weeks ago, I brought an article to our attention that said unnecessary back surgeries performed every 8 minutes at U.S. hospitals. And of course, although most of those people probably had pain as a result of the surgery. Then last week, we brought to you a headline that said chronic pain could be a silent echo of unprocessed emotions. Now, this week, we have an article from the prestigious New England Journal of Medicine called Screened Out, How a Survey Change Sheds Light on Iatrogenic Opioid Use Disorder. Now, this is written by a man with the name of Dr. Andrew Kolodny, who in some people's minds is the most zealot type person against opioids on the planet. What Dr. Kolodny is saying here is that if new data, in his opinion, says that if you are taking legitimate pain medications for very long, you have opioid use disorder. Even though your doctor's prescribing them and you have pain, you have a psychological problem called an opioid use disorder, and you should be taken off all of your medicines and put on buprenorphine, which is an opioid itself, but that is his opinion. I would like to recognize very fast that a number of people who you might say are on our side, the pain treatment opioid side, if you will, has jumped on this immediately. I'd like to recognize Chuck Dinerstein from the American Council of Science and Health, who wrote a scathing article saying that Dr. Kolodny is just so far out there that there is just no way that people who have legitimate pain, who are taking legitimately prescribed opioids, have opioid use disorder. Also, we have some of our favorite people like Red Lawhern, Dr. Stephen Nadeau, Mark Ibsen, who have been out saying this whole Kolodny thing is just incorrect. What these articles have compelled me to do is to, in a way, bring back some old knowledge with maybe a little new twist, because in the last 5 years, we've really had a lot of new diagnostic technology come forward to diagnose the causes of pain. But let me just make it very, very clear about something. Pain is a symptom of a disease. End of discussion. It is a symptom of a disease. I'll tell you what pain is not. It's not a psychological problem. It is not a syndrome. It is not a disorder. It is not a disease. It is not a vital sign. It is a symptom of a disease. Now, federal regulations say that a doctor can prescribe opioids to anyone who has legitimate pain in the normal course of medical practice. That's fair. I'm not sure they always follow that, but nevertheless, what is in writing in federal regulation says that legitimate pain can be treated with opioids. Now, I'm going to give everybody here a nice, simple, one-sentence definition of legitimate pain. And I want everybody to know this, because when people start saying you've got a disorder or you've got a psychological problem or you are this or that, you need to be able to say clearly that you have legitimate pain. I'm going to give you a nice, simple definition. Some of you may want to copy it. Some of you may want to send and get it. But I'm going to give you a nice, simple definition. Here it is. Legitimate pain is a symptom of an existing verifiable disease that can be documented by an objective diagnostic test, such as a radiologic technique, blood assay, biopsy, or electrocurrent analysis. Okay. Now, I want to go back over some of these things that have come out and related here to this simple definition, if you will. First off, chronic pain exists because you've got an underlying disease. Now, it's fair to say that over the last 20, 30 years, there's been great discussions because an awful lot of people had pain and we didn't have or didn't know the underlying cause. Years ago, we actually used to use the term unidentified pain. We used to use such terms as failed back syndrome because we didn't really know what the underlying disease was. But just to give you some idea, in recent times, we've developed the technological capability to diagnose everybody's underlying disease. And patients shouldn't identify themselves as a pain patient anymore. They should identify themselves as having a specific disease, and they need to know the name of the disease, and they need to know the objective diagnostic tests that have given you that diagnosis. Let me just to give you some examples for a minute. The contrast magnetic resonance image. That technique has really allowed us to diagnose such things as adhesive arachnoiditis, multiple disc degenerative problems, spondylolisthesis, spinal fluid leaks. It's been a wonderful technique, and we really haven't known how to use it, and the technique hasn't been all that good until just in recent years. So the new MRI contrast technology has given us the ability to identify a lot of underlying diseases. Now, I point out the MRI because I can't hardly believe that an unnecessary back surgery is being done every 8 minutes in the United States. Now, I have some advice, if you will, for anybody who receives the message from a doctor that says you need back surgery. If somebody says you need back surgery, you need two things, in my opinion. Secondly, a second opinion from another surgeon. And secondly, you need to ask the question, hold it. You say, I need surgery. What caused my problem? You do surgery for an anatomical abnormality of the back or the spine. But you just don't stand around and have your disc degenerate and slip. You don't just stand around and get tethered cord. You don't just stand around and get a spinal fluid leak. You've got to have a disease that's causing this. So before somebody gets back surgery, in my opinion, you want a second opinion. And also you want to know what disease caused my pain and caused me to have an anatomic abnormality that requires surgery. So those are some things about the back surgery. Let's talk about these unprocessed emotions causing chronic pain. That's difficult to say. What you should know, I mean, this article has been saying that if you develop fibromyalgia or arthralgia or myofascial syndrome, headaches, is that it's something to do with your childhood and unprocessed emotional problems. Well, that's just so far out, it's almost hard to discuss, except one thing. We do know now that the viral autoimmunities, particularly Epstein-Barr virus, does reactivate under severe psychological stress. Now, if they said that, I could buy that. If they said that you have emotional problems that's given you a lot of biologic stress, raise your adrenal gland, alter your insulin, raise your cortisol for a time, that's fair game. That means that you altered your autoimmune status, and that's the disease. But just to sit around and say your psychological problems caused all your pain, that's just somebody with a vested interest who wants something or another. The Kolodny article is sad, and I'm going to tell you what is sad about it. It's not just that he says that all of you folks out there who have legitimate pain and who are taking prescription drugs, taking them as prescribed and getting better, that's one issue. But the other issue is this is the New England Journal of Medicine. Okay? Now, what that means inside the medical establishment means that this article can be used as an excuse by insurance companies not to pay for your drugs, to turn you down for treatment. And when it comes out of the New England Journal of Medicine, look out. So many doctors and insurance companies, medical boards, and physicians go by it, and they will believe it, and they'll follow it. And that's the sad part about it. That's the sad part about it. I want to say a couple of other things just quickly about some of the other things that have come along to diagnose legitimate pain. Blood tests. For example, we have a blood test now for ankylosing spondylitis. We've got one for mixed autoimmune disease. We've got a test for rheumatoid arthritis, systemic lupus, and now we have all the tests for Epstein-Barr reactivation and autoimmunity, as well as other viruses. So we have the ability to take a blood test and determine a lot of diseases. And certainly a disease like diabetes can be easily diagnosed, and perhaps sickle cell anemia. And so we've got a lot of blood tests today that document the legitimate pain. It gives you a specific diagnosis as to what your trouble may be. Now I want to talk about biopsy for just a moment. The small fiber biopsies, which is just a tiny skin biopsy, is a real blessing. If you happen to be one of these people with pain all over, maybe fibromyalgia, arthralgia, myofascial syndromes, and your doctors don't quite know what it is, the biopsy today can be taken with a simple skin biopsy, and it tells you whether your nerve fibers have been damaged or if they're even present. Okay? Now, pain occurs when there is damage to nerves, nerve fibers, or if they're absent. You've heard the term bioelectricity. Well, the body makes a certain kind of electricity. I'm not quite sure whether it's exactly what's in the current coming out of your wall, but the nerves conduct bioelectricity. And if you damage that nerve, or if you don't have any, if it's entrapped, if it's eroded, if it's inflamed, the electricity is not going to flow in a normal way, and you're going to have pain. Okay? And in the brain, if your glial cells, those are your big long cells in the brain, or your receptors in the brain, are damaged because they function on electricity, then you're going to lose the mechanism to shutting down your pain. So damage to nerve tissue is what is there, and we can now do these simple biopsies. A lot of laboratories do them, a lot of physicians, and that's a very, very excellent test to document that you have legitimate pain. So if you're one of these people who you have pain all over and your doctors don't quite want to treat you, or they don't know what it is, that biopsy is quite good. And one of the new kids on the block are some of the new electrocurrent techniques. The old one is the electromyogram. It's still good. If you think you've got CRPS, you need an electromyogram. And I've worked with some other electrocurrent techniques that are for diagnosis, and some are excellent. They're not paid for by insurance, so they don't not used too much yet, but they're excellent, and they'll really tell you whether which nerve root coming out of the spinal cord is damaged, which one's not working. So your old electroencephalogram of the brain, your electromyograms of your peripheral nerves, these are excellent tests. The bottom line is everybody today needs to understand that pain is a symptom, end of discussion. Now, you can have psychological problems caused by the pain. You can have depression caused by the pain. You can have a lot of these things. But pain is a symptom, and when you write letters, when you advocate, you've got to let people know pain is a symptom of a disease, and you need to know the underlying cause of the disease. Now, we're going to ask our guest to come on in a second, but I want to summarize this by making another point. Every pain patient needs to know their underlying cause of their disease. If you can't rattle off that you have adhesive arachnoiditis, that you have pudendal neuropathy, that you have small fiber neuropathy, if you can't identify your underlying cause, you have a problem, because your doctors are going to stop your opioids. They're going to stop your benzodiazepines. You're going to have your underlying cause, and that term among doctors is common, underlying cause of the pain. Because frankly, I don't see, there's going to be some states, some doctors, some medical institutions are going to continue to cut back on your opioids and your benzodiazepines unless you know your diagnosis. So, and my recommendation is have a 3-ring binder, have a folder that you carry all your medical records. And lastly, if you've got adhesive arachnoiditis, if you've got a spine problem, you better have a hard copy, not on a disc, not on some, portal. You better have a hard copy of your own MRIs that you can hand carry to every emergency room or doctor that you may see. And in my opinion today, if you do not have those, don't be surprised that you're going to have a hard time getting treatment. In other words, the time has come. You've got to document that you do have legitimate pain, and it's really going to be your responsibility to carry your medical records, have your x-rays, have your blood test results, know what you have. Otherwise, we're going to sit here and pick up the Epic Times and see it's a psychological problem. We're going to continue to have prestigious medical journals and prestigious newspapers saying you have this disorder and you don't have legitimate pain. So anyway, that's not only my message tonight. Maybe it sounds like a sermon, and maybe it is, but the time is here to do what we've said for centuries. Pain is a symptom. It is not a disorder. It's not a psychological problem. It's not a symptom. It's not a vital sign. That's why the 5th vital sign was done away with. It's not a vital sign. It's a symptom. And so that's dragging up a lot of old information, but I hope it sheds a little light on where we're at. And lastly, if you decide to write the Epic Times and jump on them about repressed emotions, just tell them very bluntly, pain is a symptom of an underlying disease, and usually that disease is pretty serious. Okay, want to go on to that. Mark, you want to comment any more on this, on the Kolodny article, or anything else that I've just covered?
Pain is an effing terrorist, period. I don't care if it's psychological or physical or what. Whoever is seeking pain relief is seeking pain relief from their care provider in order to be able to participate fully in their lives. And it's up to us to determine an appropriate diagnosis and appropriate therapy, and give up this idea that, oh, my hands are tied. Well, I'd like to tie your neck if you want to go a little higher. I think it's time that we stop putting up with this. I had this today with a patient, ankylosing spondylitis, 39 years old, and the pharmacist says, well, you're too young to have this kind of pain. And of course, later on, she adds 20 years, she's going to be too old to have that kind of pain. It's like, it's the worst, lamest kind of excuse making that I haven't seen since my kids were in middle school. It's like, yeah, enough.
Okay. All right. That sounds right on. Okay. Jamie, do we have Dr. Salerian wants to make an announcement or two?
Yes, sir.
Good. Before you put him on, I just want to make a quick comment. You can tell I do a lot of reading. Dr. Salerian is going to tell you about his program coming on called Honesty Day. This morning in the Wall Street Journal of Medicine, in the Wall Street Journal, not the Journal of Medicine, might as well be, there's an article called The Government's Drone Denials. This is the Wall Street Journal now, and I'm going to just read you what the Wall Street Journal has to say about honesty in the government today, about the drones. He says, amazement that the federal government can't tell the public why drones are filling the night skies over multiple states and military installations. disgust at the reasonable belief that the government is refusing to explain what is happening. And it concludes its editorial. This is the Wall Street Journal now. Okay, this is not People's Magazine. This is not the Reader's Digest. The Wall Street Journal concludes it by saying, perhaps the most maddening thing about the no explanation drone response is the government's insouciance. The feds are giving the impression that despite public concern, they just don't care. Sound familiar? Dr. Salerian, I wish you luck and tell us about Honesty Day.
Well, yeah, I'm very excited. As you know, you started with the Make America Healthy Again campaign of Bobby Kennedy, and I was very excited. And I asked him, and I communicated. I said, "How can we be healthy if we're not honest? Because we have an issue here about honesty and dishonesty." I feel today we are as troubled by governmental dishonesty from human failures as we were 2,400 years ago when Plato authored the Republic. Things have not changed much. Sadly, since the assassination of President Kennedy, our elected representatives have failed to honor the American Constitution. And to me, that's the problem. This is why on February 15th, I'm very excited about this, 2025 at 1 p.m. Eastern Standard Time, 1,000 churches and 1 million people shall sing Beethoven's Ode to Joy to say, honesty matters. Honesty matters. And why do I say our elected representatives have not been honoring our Constitution? One example here. The murders of JFK, RFK, MLK. We, the people today, do not have access to the truth because of concerns about our national security. Are you kidding me? National security? How would national security justify keeping secrets from 60 years ago about crimes against humanity? Makes no sense. JFK was not killed by Oswald, but today, and also Sirhan was not a killer of Bobby Kennedy or Earl Ray, did not kill MLK. But this is what we still promote 60 years after. This is ridiculous. This is not good for us. Today, the most popular museum in America, the most popular, you know which one it is? The 6th Floor Museum in Dallas, Texas. It still teaches and promotes the idea that a lone killer assassinated our 35th president. This is ridiculous. This is a museum doing it. Now, there's a personal part to it. In 2011, Uncle Sam claimed I was a drug trafficker in the practice of psychiatry and medicine. My Uncle Sam drugged me and robbed me before shipping me to a federal penitentiary for solitary confinement. Uncle Sam cut off my wings and engineered the silencing of 4 beautiful souls who worked with me. They all died by accidents. No, they were killed. They were silenced. John Merzak, my colleague, Kevin Byers, my attorney, Solange MacArthur, my philanthropist patient. Oh my God. Siobhan Reynolds, a champion defender of patient rights. And 7 patients of mine committed suicide. This is very personal for me. Okay, because if something like this can happen to me, with all my background as the FBI chief shrink, I should say, after 5 years in 2016, all the charges against me were dropped. But my personal pain, here is the good news. I believe this problem of governmental dishonesty is fixable because it's man-made. And we have intelligent answers for it. We can fix it the way we fight organized crimes. We can also fix this. But first, people should become aware of this. This is why on that day, we're going to shout. We're going to sing Beethoven's Ninth Symphony. All at joy. This is how my conference and exhibition is going to start. And 1 million people around the world and 1,000 churches and temples all around.
Alan, how do anybody watching this, how do they get in touch with you if they would like to, join in your most welcome mission? How do they get a hold of you?
Just my webpage has all the information. That's salerianart.com has it. Basically that, and then I want everybody, you too, Dr. Tennant, I want you to send me an email and say, Dr. Salerian or Alan, I am going to be there. Okay, I want every individual to make noise at 1 o'clock, at 2 p.m. actually. I'm only asking for 1 minute. This is how we're going to start our conference and exhibition. 1 minute with the music, and then let scientists present the data on what happened here. The important part is for us to convince governmental honesty is essential. It matters. In fact, the name is, the whole show is, Honesty Matters is our motto.
Okay. Alan, in the interest of time, I'd love to talk with you a whole lot and a lot of things that you probably can't talk about, but God love you and stay with us. It's a most worthy cause. Thank you so much. We owe you a debt.
Thank you.
Just for starting this. Good.
Thank you. Thank you. Please do it, though. I
All
want everybody to register.
All right.
Okay, I want to keep a records. 1 million people.
All right.
1,000 churches.
Jamie, let's see if we can get him at least 1 or 2 of those million. Alan, thank you so much.
Thank you.
Jamie, can we bring on our next guest? We've got an exciting person here also. Gina, thank you so much. We know you've been a longtime supporter and you've survived more than your share of ordeals. Let's start with some of your basics like we do with most people. Where do you live and how old are you?
I'm 69 years old and I live in the Pacific Northwest near the Tacoma area. And I've been at this a long time. I've got a lot of problems, which started in 1983 when I had my first back surgery for a ruptured L5S1 disc. And I have not been diagnosed with AA. And I wasn't sure if I ever belonged on this podcast because of that. But I think it was Jamie that told me, well, you are an expert in many spine, issues. And where I got hooked is from the very first podcast I listened to, because you had said something that stuck with me. You said, how do you go from like one disc, that gets fixed, and all of a sudden you have these 4 or 5 all over the place. It started lumbar, but I have no discs left in my neck at all. I have a plate that goes from supposedly my head down to the T23, and 4 loose screws right now. That's what I'm dealing with. The one is by the vertebral artery, and 6 surgeons don't want to touch me. They said it's too risky to operate.
Now, Gina, you're talking about one of the great mysteries for me throughout my career, and that was, and I want you to tell people a little bit more about this. you started off with a lumbar disc.
Yes.
How, first off, do you know what caused your lumbar disc to rupture?
Well, I get nervous to say it in front of doctors these days, but my first husband threw me over the TV and table.
Okay,
Yeah,
domestic violence. Okay.
Yes.
All right, you've got that. You had the operation. How long? So you had lumbar disc, and then you later developed cervical disc disease. Now,
Yes.
this connection, lumbar first, then cervical later, it's driven me nuts. And I must say that you can tell us, but my experience has been that pain in the neck's a whole lot worse than lumbar.
Oh, it is. Oh, definitely. I would agree with that. I've had 3 lumbar, four cervical surgeries and a stimulator put in, which was worthless.
It was worthless.
Yes.
How many discs went out in your neck?
Well, it started with 1 in 1990. They had to take me into surgery pretty quickly because the surgeon said it was sitting directly on my spinal cord and was worried that I might be paralyzed. I came through that fine, except that's when I started having more lower back problems again.
Mm-hmm.
So,
how long was it between your lumbar and your neck? How many months?
83 to 1990 was when the first cervical was done.
So you really went about 6 or 7 years.
7 years, yeah.
7 years, okay. And I don't suppose you brought an X-ray with you, but
I have it, but I don't know how to do it.
They're pretty awful looking, aren't they?
Well, yeah, and I have my my last medical reports, which aren't pretty. I have okay, in my cervical, I'll just read them off because, like you said, don't say just pain. I'll tell you what it says briefly. Okay. Right lateral mass screw at C2 protrusions 3 millimeters into the right neural foramen. Both lateral mass screws at C3-4 beyond the ventral cortical margin, 6 millimeters on the right and 4 on the left. At C4, both lateral mass screws extend beyond the ventral cortical margin, 7 millimeters on the right and 3 on the left. On the right, this is likely in the vicinity of the right vertebral artery. At C5, both lateral mass screws extend beyond the ventral cortical margin, 5 millimeters on the right and 3 on the left. On the right, this is in the vicinity of the right vertebral artery. At C6, the left lateral mass screw extends 3 millimeters beyond the ventral cortical margin. And it says a little bit further down, a few of the lateral mass screws may be affecting the exiting nerve roots. This is most significant on the right at C4, C5, and C5, C6. Then in my lumbar spine, it says degenerative grade 2 anteriolisthesis of L4 over L5 with mild associated canal stenosis. No evidence of CSF leak. Good. But yet I was told a couple of years ago on my last test that I had severe stenosis, extensive arthritis, but see, I can't have an MRI anymore either. And I don't know what is the difference, what one shows in the other, really.
Yeah, you just said something else. Do you have some pain issues outside your spine? You said you have arthritis too?
I have been I was diagnosed also years ago with carpal tunnel. Mm-hmm. I've had neuropathy for years, right thigh, left foot, constant. The last couple of years, I started getting in the groin area on the right side primarily, but maybe a year ago, I'm sensing it on the left at times now as well. My shoulders are a mess. Oh yeah, from a blood test, I I believe it's the ulnar nerve that was permanently damaged. So many of my problems, I'm afraid, are due to medical procedures.
Okay, very good. Now, trying to control pain that you have, I mean, in simple terms for those people watching, what her MRI fundamentally says, she's got multiple degenerative discs in her neck that are pressing on various areas of the cervical neck from here to here. Okay.
Yeah.
And it's very painful. Okay. Now, what have you, and first off, you're 69. In a way, I'm surprised you made it this long.
Thank you.
We'll get
Me
back to
too.
talking about that in a minute, but on how you managed to survive this. What are you doing for pain relief? Because I have some real views on this myself, but what are you doing and what have you found that helps your neck pain?
Actually, I know I get concerned about doctors prescribing it, but Belbuca a few years ago was like magic for me. It allowed me to do things that I never dreamt I would do again. I was walking through parks. I mean, I was doing things, and it was like magic for me. Now I still needed tramadol, but I would take one tramadol maybe 3 or 4 times a day. Well, something happened a year ago, last August. I was just walking in a park, and all of a sudden I had such a horrible pain in my left lower back. And I just thought I was overdoing it, but it never settled down. So I'm still on 450 micrograms of Belbuca. I'm taking tramadol 2 at a time. Since then, I need 2 or it doesn't help. But now I'm in trouble because I also have osteoporosis severely. And I just got an injection, a Prolia injection. It's been 7 weeks, and Dr. Tennant, I've been in hell ever since. My everything, it's like within an hour after I got home, it was like my body, everywhere I have problems, attacked at once and sent me to like level 9, 10 pain. I haven't had trouble with the carpal tunnel in years. It was diagnosed when I was 40, and they were talking surgery, but faithfully wearing the splints every night kept it at bay until this. Now another thing that does help is kinesiology tape. The gabapentin also does help my neuropathy. It did. It took it from 24/7 severe to, if I get out of a bad position, it'll ease up a bit.
Supplements? What are you doing for supplements and diet?
I've started with the colostrum and what's the other C? That you collagen. Yes, I'm sorry. Thank you, JB. And I am on vitamin D. I've been on it quite a long time. And yeah, I guess that's it right now.
Okay. Have you found any topicals that you can rub on your neck, or anything like water soaking or heat, ultrasound, anything on your neck that you can do physically to it that helps?
Well, I wear the brace in part just because if I move my head the wrong way, the slightest, oh my gosh, it sends bad pains into my head. And in fact, that's how we found out about the screws, because I thought I had a stroke and I didn't. But that's where they said it must have hit that vertebral artery or something when I moved the wrong way. And so nothing, it seems like heat will help my lower back a little bit, but it seems to make the neuropathy worse. So I feel like sometimes I can't win.
Mark, are you there? Would you like to ask her anything?
Oh, yeah.
Yeah.
So let me get this straight. you had a doctor who said it was urgent to provide surgery to you because you were near paralysis and they had to rush you in.
With the neck, not the
With the
back,
neck.
but the
With
neck.
the neck. So
Yes,
now your screw is near your vertebral artery and they don't think that that's urgent and life-threatening?
it is. And
Yeah.
but they're all afraid. 6 surgeons have told me they're afraid to touch me because it looks like so fragile in there. They're afraid just going in there is going to cause a crisis, as they said.
Yeah. What would you like? Would you like your pain dealt with at the risk of a
Yes.
crisis? Or would you like to just go on like you're going on now?
Oh, I would rather they try to do something to fix this, because I still feel young enough. I'm not ready to die yet. And that's why I'm careful. But the
Yeah.
tramadol.
So I think there's a point here to be made, is that when there's money to be made, let's do the surgery. It's urgent for you.
I think
When
so.
there's complications to face, it's like, oh, let's not do this.
Yeah.
So it upsets me that you are left with surgical complications
Yes.
and no surgeon willing to address them. And
Right.
I think that's a crime, frankly.
To me, it is too. Yes.
I'm so sorry.
Yeah.
Thank you.
Gina, in the interest of time, I'd just like to say that you've certainly survived this, and appreciate you talking about it. The neck problems are much worse than anybody realizes. Let me just wrap up with one sentence. I get asked a lot of times about arachnoiditis in the neck. Okay.
Mm-hmm.
Now, I don't talk much about it because it's a complex subject. Let me tell you what's complex about it. We use the term adhesive arachnoiditis to refer to the lumbar area or lumbar sacral area only, because in the lumbar area you have the caudo-equina nerve roots that become inflamed, eroded, and form adhesions and stick to the wall of the spinal canal. That's why it's called adhesive arachnoiditis. You don't have any nerve roots hanging down in the cervical spine. To make a diagnosis of arachnoiditis, which means inflammation of the arachnoid, I'm sure you have that. And I've looked at lots of MRIs it's a diagnosis that's not that specific. I call it and I recognize it, but it's not clear. Okay. But you probably have it, and the arachnoid is in the cervical spine, in the canal, and it hurts like the devil when it gets inflamed or pressed on. And that's,
Yeah.
I do believe that plain arachnoiditis is one of the major causes of such severe neck pain. You've been great to be on the show. We need to talk to a lot of people about neck pain. My most recent person that I did some counseling with just went to Sweden to commit suicide because he could not relieve his neck pain, even with injectable opioids and pumps and everything else. It's
I can
a terrible
understand
problem.
that. Yeah.
Yeah, I know you can. And anyway, there's also somebody who watches this show, Allison Guyton, is one of our regulars. She's written up something about arachnoiditis in the cervical neck, but it always accompanies these other problems. So it's not a unilateral single disease of the neck, but I do think it's there. Stay with us because it's you belong here with us, and cervical arachnoiditis and cervical disc disease is a terrible problem, and we don't talk about it enough. Thank you so much for being here and sharing.
Real quick, Dr. Tennant, this is for you and for Gina.
Yeah.
So, Dr. Tennant, your person who went overseas for medical aid in dying, was that person inadequately trained for their treated for their pain?
Originally, yes. Couldn't get any help. Yes.
Yeah.
Yeah. And Gina, are you inadequately treated for your pain right now?
Yes, especially since the Prolia injection, where my lower back, I mean, my back is killing me like it hasn't in years. And the
So
bill,
why is your pain not being treated?
they're afraid.
Of
They're
what?
afraid that they're going to get in trouble. He said he cannot give me any more medication, and the PA now is having me talk to the doctor again next month. So I'm hoping he will help, but I'm not too optimistic about that.
Well, if they're too afraid to do your surgery and too
I
afraid
know.
to treat your pain, maybe they can buy you a plane ticket to Switzerland. I
Yeah,
don't understand this. I mean, this is,
me
your
either.
pain is bad. You and your insurance company have spent hundreds of thousands of dollars having procedures, and now
Yes.
they're afraid to do any more, but they're also afraid to treat the complication of the procedure. And I think that's unconscionable, and we have to address it in this country and with you specifically.
Thank you so much. Thank you. It means a lot.
Well said, well said. Uh, Gina, thank you so much. I want to call Dr. Ibsen back on for just a moment. And then, Mark, you just said something that reminds me, I'd like your thoughts about something. I see where the federal government is now wants to spend $40 billion to provide weight control, the new weight control medicines for people free of charge. Now, they don't want to treat anybody's pain or pay for it, but they want to pay for fat. It's ludicrous. So if you have a comment on that, fat or pain, the federal government seems to take like fat better than pain. Plus that you've got some other good news though that I do want to hear about.
Yeah,
Take it over.
Obesity is a mild risk factor, but very mild risk factor. It's there's a lot of people who are, over the average weight, yours truly included, and it's a slight risk factor for some, maybe shortened life, but it is not the kind of risk factor that pain is. I hate to argue against treating one thing when another thing isn't treated. I mean, I think we should treat everybody individually and get them as healthy as we can so that they can live a life that means something and that thrills them and turns them on. So sometimes being overweight is a limit to having that kind of life. So I don't know. I think there will be consequences of this kind of massive treatment of obesity with these medications. I don't think we have any idea what we're doing long term, and there should be long-term studies before this is taken on and paid for. But we have long-term studies about pain, and nobody's doing it. So the inconsistency is sort of a form of gaslighting, isn't it, Dr. Tennant? I mean, how can we take on obesity when we haven't even solved some basic problems, like like the hypertension that pain patients get?
Yeah.
I had a patient admitted to the hospital, and they were treating her with less medicine than she got out of the hospital, and her blood pressure went from low because she was dehydrated to skyrocketing high, and they wouldn't treat her pain to get her blood pressure under control. And they're putting it at risk for stroke. You can use 4 or 5 blood pressure medicines, and they don't work. So we've got a long ways to go. Medical equity would be a great topic to talk about at some point. And it doesn't exist so far. If you've got money and you're white and you live in a city, yeah, you might get lucky.
Yeah. Well said. Well said. Mark, tell us about, you understand the American Medical Association may have taken a step in the right direction.
Yes. So I heard from Chad Kollas about this, that the AMA is decided to engage in the pain conversation, and basically change their extremely passive "who me" attitude towards pain. It's like, who's that guy in Mad Magazine, Alfred E. Newman? What, me worry about pain? But they have decided to actually treat it. And I sent you a very hopeful, in a hopeful moment of my own, I sent you a podcast interviewing 3 members of the Federation of State Medical Boards. And I'm sad to say, after listening to the whole thing, they are hemming and hawing their way through this talk, and they're not saying enough to say treat pain. I mean, they say it in this soup of conversation that they have, and they do say that it should be individualized, and that we've managed to eliminate a lot of prescriptions, and we haven't succeeded in decreasing overdoses, and it's time to face that fact. And they did bring that up, so it wasn't particularly strident or militant enough for me, but it's a step, and I'm sending it out to all the boards, so that they can read what the Federation of State Medical Boards, which is the supervising agency for all 50 medical boards in the country, that they're saying, treat the pain and treat it individually, and follow closely, because it's complex stuff. So that's good news.
Yeah, it's a step up. Well, to close out, we're going to cover on this program anybody who is trying to shove something down our throat about disorders or psychiatric problems or pain as a harmless thing. You just said it well. It's a terrible risk factor. It has many complications of its own. And we're going to make it clear. We want pain symptomatically treated to whatever you need to be able to function, be comfortable, and have a good life. At the same time, we want the underlying cause of pain recognized, diagnosed, and treated. We want both done, and we're going to keep on with that. Incidentally, next week we are going to have a show. I'll be here. Jimmy will be here. Mark, I know you'll be here.
I sure will.
Yeah, we're not going to let something hold back our mission here.
Well, I certainly think that there are people in this country that deserve coal in their stockings, and I'm going to make sure I do my best to make sure they get some.
Yeah, well, I've got a couple of candidates myself. With that, happy holidays. It's been a great show. Thank everybody. And Gina, thank you so much. You're going to lead the neck parade. Okay, with that, we'll sign off till next week. Good night.
Thank you.
Good night.
So much.
God bless us, everyone.
Yes, God bless us, everyone.
Thank you.
See
God
each
bless
other.
you, everyone.
I think
Get a
on
sack full of
Christmas.
hickories, what they'll get.
God save the pain warrior.
Amen.
Thank you,
We're gonna
Carson.
see. I know Dr. Norm had something he'd like to add.
We continue to write at You're Within the Norms. You know, we've our articles are now have podcast analysis with it. So myself and Dr. Arnon have been going over some of the papers that we've written. We do a podcast analysis and break down to what are the substantive issues we wish to discuss. This week we republished an article that dealt with the Miranda rights. You can see that up on You Are Within the Norms. I ran into a very interesting group. I was looking at how they use a strategy of coalitions to defend themselves, and they gathered all these people from different political beliefs. And essentially, the argument with the government was the First Amendment, and these folks were able to by forming a group, a diverse group of people began to rally around the First Amendment, got donations, and they were facing 25 years in prison essentially what the government did was give them 3 years probation, 300 hours of community work, and no fines, and get out of here, don't bother us again. So that's how you fight, and it's a lesson that I learned in how we get the kind of lawyers and fight with various groups and coalitions and stuff. So that's pretty much. I wish everybody a Merry Christmas, Happy Holidays, and we'll see you next week. But thank you so much.
Thank you.
Thank you.
Thanks for being here with us,
Doc.
everyone.
Yes, thank you, Dr.
Hope
Norm.
you have a Merry Christmas.
Yes.
And I hope everyone can go to salerianart.com and check that out. And also check out youarewithinthenorms.com. Lots of good stuff there. And we will see you next week. I hope you have a great Christmas. And I hope Santa Claus is good to you. No, no coal in anybody's stockings except those that deserve it.
Thank you.
I love you all.
Merry
Love you.
Merry Christmas, everybody.
Bye.
Merry Christmas.
Everybody wants to
Merry
unmute. There you go.
Merry Christmas, everyone.
Thank you.
Merry
Merry
Christmas.
Christmas.
You.
Love you all.
Love you
Love
too. Love all of you.
In there, everyone. You're
Thank
not alone.
you. That's right.
Now
Merry
you're on.
Christmas.
Love you guys.
We love
I
you.
love you. You great.
Thank you.
Thank you all so much. God
Merry
bless you. I
Christmas.
love you and Merry Christmas.
Take
Merry
care of
Christmas.
yourself, Jamie. Love you.
Thank you. I love you too. Thank you.